Good morning. My name is Jerry Allen, a public advisor co-lead for the MIDAS project. It is my great pleasure to introduce the next speaker at today's event. Our speaker is Oluwaseun Ibiwoye, a perinatal mental health specialist at Liverpool Women's Hospital. Today, she will be delivering a pre-recorded presentation about a recent mental health races study. We hope you find it useful and interesting.
Hello, my name is Oluwaseun Ibiwoye. I currently work in mental health as a psychiatrist in training. I just completed a RACES internship with the Applied Research Collaboration Northwest. I just want to briefly touch on what a RACES is. So RACES is a rapid evidence conversion summary where you gather evidence or findings from one or more high quality systematic reviews, and then you put everything into a commentary write up. My project was on the impact of COVID-19 on perinatal mental health. As we may all know, there is a long-standing inequality in the provision of specialist perinatal mental health care in the UK. In England alone, for every 1 year cohort of births, the long-term costs for lack of timely access to good quality perinatal mental health care is estimated to be £1.2 million to the NHS and social services and £8.1 billion to the society. That's quite a lot. Therefore, I decided to do a project on perinatal mental health because of this health inequality that persists, particularly in this vulnerable group of women. I did this project to understand the impact of the COVID-19 pandemic on perinatal mental health in order to be able to tailor interventions for service users and also to help for future planning in times of crisis. Since the onset of the COVID-19 pandemic, there have been concerns about its impact on perinatal mental health. Just to say that the perinatal period is the period from pregnancy to 18 months after childbirth, and this period can be particularly risky for women. Women can be at risk of new onset of mental illness or a relapse in their mental health if they already have a pre-existing mental health problem. And the concern here is not just about having a new onset of mental illness or having a relapse. The concern is actually that, and the fact that it can have serious consequences on the health of the mother and that of the child as well. So in the mother, there can be risk of spontaneous abortions, preterm delivery. Women can have fetuses with intrauterine growth restriction, or they can have babies that are small for gestational age. In addition to this, mother to infant bonding can be impaired with poor mental health in the perinatal period. Also, there is evidence that children of women with perinatal mental illness, that is, children that their mothers had mental illness while they were pregnant with them, can be at future risk of mental illnesses themselves. So we can see that the risk is quite high when a pregnant woman, has mental illness that is not addressed or that is not prevented during the perinatal period. So for those reasons, and particularly because the COVID-19 pandemic impacted on the mental health of the general population, I wanted to explore how it impacted on the mental health of perinatal women, particularly because they are at high risk of having a relapse or onset of mental illness. So, for this project, I was supervised by two people. First is Professor Jillian Thompson, who is a professor in perinatal women's health in the University of Central Lancashire, and also James Edward Hill, who also works in the University of Central Lancashire. The project started by identifying high-quality systematic reviews that already addressed the topic, that is the impact of COVID-19 on perinatal mental health. Then we gathered evidence from those reviews, and we were able to write some commentaries based on this evidence. So, two of the commentaries have been published, and one is still currently being reviewed, hopefully to be published soon, if accepted. The findings from those reviews suggested that the prevalence of depression and anxiety have increased since the onset of COVID-19 pandemic in perinatal women, such that clinical depression is present in 1 in every 4 pregnant women, and anxiety in 1 in every 3 pregnant women. The impact also is such that the severity of depression symptoms were actually found to be more at the peak of the pandemic. The reviews also suggested that the increased prevalence could have been underestimated because they were estimated with screening tools. Depression and anxiety were estimated using screening tools. And there is evidence out there that when screening tools are used to estimate the rate of diseases, there is the likelihood of having an underestimation. So the point here is that although the findings suggest that there have been increased prevalence of anxiety and depression since the COVID-19 pandemic in perinatal women, it's actually possible that these estimates showing increased prevalence were actually underestimates, not the true estimates. So it's very likely that the impact is much more than what we have currently as evidence. And also, apart from the fact that screening tools could have underestimated the prevalence, it's also important to know that women, particularly perinatal women, may not be so forthcoming about their mental health due to concerns with stigma, fear of being labeled as inadequate mother, or fear of social services involvement, which could cause them to be separated from their children or from their child. So it's possible that even though they filled out they completed the screening tools, they actually did not put down how they felt, and this could have led to an underestimation as well, which anyway still showed us that the prevalence has increased since the COVID-19 pandemic started. So following the findings about the increased prevalence of anxiety and depression, we were also able to identify some protective and risk factors for poor perinatal mental health during the pandemic from one of the systematic reviews. And this is very key to recommendations for future interventions in the event of another pandemic. So factors such as prior mental health problems or diagnoses, poor family support, social isolation, and pandemic-related stress were identified as risk factors, whereas factors like good sleep, exercise, access to prenatal care I would like to repeat that again. Access to prenatal care. So access is key. And availability of social support were found to be protective. And this is just to mention a few. There were some other factors that were identified as well as being protective and others as risk factors. But I just think it will be a very long one if I have to mention everything here. But I think I've touched on some of the key factors to take note of. Apart from the findings from this review, I also had a meeting with midwives and some other relevant stakeholders. And findings from this meeting revealed that a survey was done across various NHS trust hospitals in the Northwest. This survey was done in prenatal women in 2022. And it showed that a significant proportion of prenatal women were not asked about their mental health at each contact with a health professional. So currently there is a guideline by NICE that at each contact of a perinatal woman with a health professional, they should be asked about their mental health, but this is not the case. I tried to explore this with the stakeholders I had a meeting with. Why is it not being done? Why are they not being asked about their mental health? And some of the issues that came up was not knowing how to ask women about their mental health because they are not mental health specialists. They are not trained to do that. So you just feel like they may not be asking it the right way. So sometimes they skip those questions. And some women that were actually asked about their mental health in this survey raised some concerns as well, that they felt that they were not asked about their mental health in a sensitive manner. So they didn't even really give much out. They didn't really say much, although they felt that they could have said more about how they felt, but because it wasn't quite sensitive enough, they didn't really say much. So these were the issues that were raised during that meeting. And so part of the RAISES project is you have identified that there is a problem, there is a health inequality. What do you want to do? How do you want to make things better? Are you going to suggest an intervention? Are you just going to let things slide by? So, well, having recognized that since the COVID-19 pandemic, there have been increased prevalence of anxiety and depression, and we know that the pandemic, COVID-19 is here to stay. Women are still anxious about how it could affect them, how it could affect their babies. Then we need to do something to pick them early, especially those that are struggling with their mental health, so that we can prevent the negative consequences that this could have on the mother, the child, and the society as a whole. So I thought about an intervention that would address the insensitivity concern raised by women, and also address the concern raised by midwives, health visitors, and other health professionals about not knowing how to ask women about their mental health. So why can't we co-design the screening forms with women such that we know what they want, we ask them what they want, and we use that to design a screening form. So in a way, hopefully, the insensitivity issue will be addressed. But it's not just that. Apart from that, women can actually do the screening themselves. How is this going to be done? This can basically be achieved by using a QR code that women can scan, and it will link to a page with a screening form for mental illness. Of course, the screening forms would have been co-designed with women, and they have the screening at the tip of their fingers. They can complete the forms on their own. There's nobody asking them questions. People that may not know how to ask this question anyway. And it's not just about the screening. The QR code, when scanned, would also link to a page that has the list of all the perinatal mental health services that are available within the locality for women to access if needed. So they have that information at the tip of their fingers as well. Hopefully with this, screening can be increased for mental illness in perinatal women, and those that are at risk can be picked promptly and can be signposted to the appropriate services. Well, this is just the intervention that I thought of. It's not been implemented yet. It's not been done yet. It has to be approved by the relevant stakeholders, and it is just going to be piloted in one of the NHS trusts. If it is a successful one, following evaluation, if we see that it's been effective in increasing the awareness of women about available prenatal mental health services, and also in increasing for screening in women, then we can hopefully roll this out to other NHS trusts within the region, and the ultimate goal would be for these to be rolled out globally based on evaluations and based on the effectiveness of the intervention which is being proposed. So that is a summary of my internship with the ARC Northwest. Just to mention that on a day-to-day basis, I work as a medical doctor in mental health as part of a multidisciplinary team. I have experience in the community and inpatient setting. Although currently I am rotating through different subspecialties in mental health, I have a particular interest in perinatal mental health. Hence, the reason why I chose to do my RACES internship on perinatal mental health. Currently, my work involves assessing newly referred patients to the team, risk assessment and management, liaising with other professionals relevant to the care of patients, and putting an appropriate management plan in place. I currently work under the supervision of a consultant psychiatrist. Please feel free to get in touch with me if you have any questions, any clarifications, any suggestions, or for collaborations. I would love to collaborate. I'd be happy to welcome your suggestions, if any, as well. And I wish you all the very best in your various career. Thank you very much.